Okay, it's time to stop live streaming. So I think we are live. I'm going to ask Kylie to check on that and then check back in with me. If not, I will continue to work on it as we get started here. So welcome everyone that is in attendance. I'm Alice with the Carbon Chamber and Economic Development Corporation here with you this morning. We appreciate you joining us today as we continue to provide our members and community members with valuable information to help them improve their lives and their businesses during this climate. Today, we kick off the State of the County webinar series with an update from our healthcare systems. We're going to hear from two of our community leaders and event sponsors, St. Luke's University Health Network. We have John Nespoli, and Lehigh Valley Health Network. We have Terry Purcell with us this morning. To say these gentlemen and their staff have been busy over the last year is an understatement. We cannot thank them enough for their hard work and dedication as we've moved through each phase of dealing with our worldwide pandemic locally. As we work towards that 70% vaccination here in Pennsylvania, we know the information they provide today will certainly be relevant and ever changing. So we will continue to share their updates from each health network on our website, carboncountychamber.org. We will continue this series throughout the summer with updates from education, employment, county and state government, our real estate industry, tourism, and more. So be sure to check our website for more of these events coming up. As a reminder, today's program is being broadcast and recorded and will be shared with the entire chamber membership and community to view at a later date. We hope you enjoy today's program. I did want to take a moment and thank our sponsors. Some of them are with us today. With Mock Chunk Trust Company, Pat Riley and his team are always supportive of the programs we bring you virtually and in person. Blue Mountain Resort, Barb Green and her team are also great supporters of the chamber. Of course, with us today from Lehigh Valley Health Network, our sponsors, Terry and his team, have been leading us through the last 13 months. Terry, your updates make us feel informed and safe as we continue to navigate the situation in Carbon County. And John Nespoli, our friend from St. Luke's University Health Network, and his team have sponsored today's program. Thank you so much, and your team, for your efforts in guiding us along the way to recovery, post-COVID-19, and the look towards the future. We're thankful to have you here in Carbon County. I also wanted to recognize our board of directors and staff that are with us today. We have joining us, again, John Nespoli from St. Luke's University Health Network, and Terry Purcell from Lehigh Valley Health Network. Thank you both for being on our board and for your support. Also joining us today are Jane George from PPL and Pat Riley from the Mock Chunk Trust Company. We love having you on our board and our team. From staff joining us today, we have Kylie Adams, who is new to the Carbon area, and we're very excited to be working with her. Thanks for joining us today, Kylie. We are going to kick things off today with John Nespoli from St. Luke's University Health Network. The network has a commitment to the community, and John would like to share a little bit more about that and the many great things that are coming to the residents of Carbon County. Ladies and gentlemen, please welcome John Nespoli.
Well, thank you, Alice, and good morning, everybody. It's a real honor and privilege to be here this morning to give you an update on activities at St. Luke's. And I think, Alice, you're loading my PowerPoint presentation for me. It's pretty brief. As she's doing that, I do want to thank the community for the great support and the great cooperation we've had in dealing with the virus. I do think we're turning the corner. I'm sure Terry agrees. And we've done over 8,000 vaccinations now at our vaccination site. And I've always been impressed with the cooperation of the community, the spirit of the community. And I think you've played a huge role in helping us turn the corner, brighter days ahead. So with that, let me give you an update on St. Luke's vision for Carbon County. And I love this slide. The top picture, of course, is a picture of what our new hospital will look like when we're finished. And we're getting there. We're on time and on budget. And if you haven't seen the site, drive out to Franklin Township and take a look at it. It's on 100 acres of beautiful land, great location. And I'll say more about the capabilities in a minute. And let's not forget about the existing campus at Lehigh. And we've done a lot of improvements to the campus, a lot of new services. It too has a very bright future. Next slide, please. This is sort of a nice summary of our vision. Our vision is that we believe we can achieve a nationally recognized model of excellence for rural healthcare delivery in the greater Carbon County area. And then these are the elements of that. The first goal is to achieve national recognition for our excellence in quality, and patient experience, and employee engagement. We received some great news at St. Luke's this past week from Watson Health, which rates hospitals. Our St. Luke's Bethlehem campus actually achieved the top status in the country for large teaching hospitals. And then the St. Luke's Anderson campus, the St. Luke's Minor campus, and St. Luke's Allentown campus has also achieved top 100. And to achieve that, you have to be in the top 1 or 2%. And I'm proud to report St. Luke's Lehighton is getting close. We're on our way, and that's our goal. Our goal is to crack that top 100 in the near future. There have been pretty dramatic improvements over the last couple of years in all the quality and patient experience and employee engagement scores at the hospital. So the culture is great, and it always has been. The second element is an accessible primary care and urgent care network. And this is usually the point of first contact for healthcare. We now have over 40 family physicians in the greater Carbon County area at St. Luke's, and that's supplemented by 3 urgent care centers. These are walk-in centers, and they're open 7 days a week, typically extended hours, long, after the family doctor office hours close. That's when urgent care kind of picks up. And all 3 centers are very busy. And of course, we have the 2 emergency departments at the Miners campus and at the Lehighton campus. And when you put that all together, it's hundreds of thousands of visits a year serving the county. The third element is the local presence of medical and surgical specialists that are based in the county. And in the last couple of years, St. Luke's has recruited dozens of new specialists in just about every specialty. I'm going to give you more detail on that in a second, but the goal is, of course, to make sure we don't have to leave the county for care. And obviously relevant to that is our new regional medical center in Franklin Township. And our goal there is to provide the highest acuity of care so our patients don't have to leave the area. And specifically in the hospital, 24 hours a day, 7 days a week, will be critical care specialists. And these are providers that have advanced training in all the modern procedures and technologies and capabilities to take care of the sickest patients around the clock. And they are supplemented then by very rapid access to all the other surgical and medical specialties that a patient needs. So very high level of care. And our goal is to make it very, very rare to transfer out of the county. And then the next aspect, and I'm really excited about this, St. Luke's has a 4-year medical school and teaches hundreds of residents and fellows who after medical school get advanced training in their specialty. And we are going to have several dozen of these medical students and medical residents and medical fellows at our new hospital. So it will be a major teaching center. And what thrills me about that is that as these providers complete their training, of course, our goal is to make sure they stay in the community and that this will be a source of high quality providers for generations to come in the county. And then beyond the medical aspects, we are going to start a St. Luke's nursing school in the county sometime in 2022. And the same goal there is to train nurses and to, as they graduate, keep them in our community. And then the final aspect on this slide is back at the existing Lehighton campus to make that a regional center of excellence for behavioral health and acute rehab and post-acute care. In terms of behavioral health, of course, we'll have inpatient care and outpatient care and partial hospitalization. But also we'll be starting in 2022 a new concept called behavioral health walk-in capabilities. And similar to urgent care centers, this will be specific for mental health crises. So 12 hours a day, 7 days a week. Typically in the past, if someone's in a mental health crisis, they go to a hospital emergency department. That can still happen if that's the choice of the patient. But the other option will be to walk into a behavioral health walk-in center with extended hours and have immediate access to behavioral health assessment. And then we can figure out what level of care that patient will need. There is no such service in the greater Lehigh Valley area. And actually, we've been talking to other centers out of state. And it typically about a third of these patients that walk into the urgent care center for behavioral health are admitted, but 2/3 are typically discharged to an outpatient setting. So we're really thrilled about that. And then, of course, our acute rehab hospital will stay at the existing Lehighton campus. We've recently done renovations there. And the Summit Long-Term Care Facility will remain. And we're about to begin renovations at the Summit. So that is the vision. Next slide, please. And then this is a list of all the providers that we have recruited to the county or in the process of recruiting. And as you can see, it really does add up to dozens of new providers based in the county. So cardiology, I mentioned critical care. We're recruiting two additional providers in endocrinology, which is basically diabetes care, but more. 4 new GIs, a new general surgeon who actually happens to be a cancer surgeon, Dr. Ali Botash. And this excites me. This is a very young surgeon who did her general surgery training at Harvard University hospitals, and then did an advanced fellowship at one of the finest cancer centers in the world. Just a young, dynamic woman who will be full-time at our new hospital doing breast surgery, colorectal surgery, and other high-level cancer surgery locally. Other recruitment, hospitalists, interventional radiology, much of that is vascular work, a new medical weight management program in Palmerton, recruiting additional nephrology, which is kidney, neurology, more OB/GYN to the community, oncology. We have recruited additional orthopedic surgeons. We have a new pain management capability, expanding palliative care, more pediatricians coming to the community. I already mentioned primary care. Obviously, recruiting more psychiatrists to support the expanded behavioral health role. And by the way, we are starting a new psychiatric residency specific to the mental health needs in rural healthcare. That'll start in 2022. And then you can see all the other specialties, pulmonary, urology, vascular, and so forth. So very comprehensive list of new specialty talent coming to our county. Next slide, please. This cool picture, it's amazing to me how quickly the hospital went up. To the left is a picture of the 100 acres just about a year ago. And to the right is the status of the new hospital. And actually that picture is a couple weeks old, but you can see how beautiful the campus is. You can see the surrounding area. And it's really a fascinating concept, beyond the medical center. And we want this to be a showplace and kind of a destination for residents of the county. It'll have walking trails. It'll have beautiful healing gardens, wildflower gardens, and much of the land will be organically farmed. So just the whole wellness theme beyond the highest level of medical care. Next slide, please. I think it's another picture of the new hospital. Just gives you a better sense of how the facility is structured. And honestly, I think there'll be more development on this site over the next generation, to be honest. We already are starting to think about plans for a phase 2. Next slide, please. Just a word about the Lehighton campus. If you haven't been in the Lehighton campus, I think you'd be surprised. Just a beautification process that we've been working on for several years now. And just a lot of progress with not only the facility, but the technology. So it really is prepared for a very bright future at the existing campus. Next slide, please. This is just an example of an existing service. We developed a new cancer center and infusion center, and this is the existing facility. So you can see how bright and modern it is. Excellent medical oncology and nurse practitioners and support services in cancer. And the infusion center opened last October, and very, very busy. And already we're in the process of expanding the number of infusion chairs in this center. Next slide, please. Just a word about Palmerton. The medical mall concept fascinates me. We've had this at the Lehighton Medical Mall on 9th Street for many years. When we say mall, what we mean is multiple services conveniently located. And so at the Lehighton Mall, for example, we have a primary care center, specialty offices, we have outpatient services like physical therapy and lab and radiology, and a walk-in center. So that has been at Lehighton for a while. So we sort of replicated this model in Palmerton. So building A does house 4 family physicians who are all very busy. And the Care Now, the urgent care now, and basic lab and radiology. Building B, which opened in January, is the medical and surgical specialties center. It's right across the parking lot from primary care offices in the Care Now building. And virtually every medical and surgical specialty will be available in that building. And then building C, which we're opening in a month or two, is across the street where the Dunkin' Donuts is. The intermediate school moved out of that building recently. So we're occupying the entire building. And that's opening as an expanded pediatric center and an expanded OB center. And there'll be shared space for child education, new mother education, something called Baby and Me. So there'll be an educational center in that facility as well. And then finally, we have a 4th building where we house orthopedics and outpatient physical therapy in Palmerton. So very comprehensive kind of one-stop shopping of most outpatient services conveniently located in Palmerton. I think that is that the last slide? I think it is, Alice. Yeah, so I hope that gives you a sense of where we're going. And again, I think this will be ever evolving, and we're just thrilled that we can deliver this kind of comprehensive care to the community. And of course, it does add hundreds of jobs for a vibrant economy in Carbon County. Thank you.
Thank you so much, John. And ending on a positive note, many more jobs coming to Carbon County. We are so excited to hear about the new facility for learning coming to Carbon County. Thank you for that update. It's hard to believe it's been just 2 years since we started this with you. So look forward to a future. Your team for sure, with us today. Really looking forward to what's next.
You bet, Alice. We're thrilled to
broke up.
Our next speaker is working hard as a great partner here in Carbon County, as well as on our board of directors from LVH. Ladies and gentlemen, please welcome Terry Purcell.
Well, good morning, everyone, and thank you for the Chamber for hosting this event. I just want to start off by thanking everyone for their help during this past year. Representative Mooser, Tom Gerhardt was checking on us all the time to make sure we had what we needed. Representative Doyle Heffley was calling John and I every other week just to get an update. The commissioners did a great job, and having the COVID task force, the community just was 100% behind the healthcare providers. So we do appreciate that support. And as we titled this, I titled the presentation, we called it Better Days Ahead, because we all know the last year was very difficult, and but we are getting through and things are getting better today. Next slide, please. Just wanted to start off by talking about the last year and saying thank you to our employees. It's amazing what the healthcare employees could do when the chips are down. People don't go into healthcare to make a lot of money. They go in because they have a genuine concern for people and they want to care for them and provide for them. So I just want to say thank you to all of our employees. And also to all the frontline employees at other institutions, grocery stores, policemen. We just appreciate everything that you've done for us over the last year. Next slide, please. Just continue to say thank. This is two kids sent this to one of our providers. Not all heroes wear capes, and thank you to our healthcare workers. Next slide, please. And just a group, our employees have a lot of heart, and they were there for the patients, and we do appreciate that. Next slide, please. So just want to talk a little bit about the last year in COVID. It was a long 13 months. It was a trying 13 months. And I think Lehigh Valley, we responded very well. I think both networks did a very good job caring for our community. And I'm particularly proud of what we did at Lehigh Valley. The first thing we did is we set up COVID testing sites. We Palmerton Express Care, and we just made it for COVID patient testing. And the reason we did that is we didn't want patients that were having other urgent care emergencies sitting next to someone that possibly could be COVID positive. We initiated free virtual visits. So the first thing, if someone thought they had COVID, they got a free virtual visit over the telephone by a healthcare provider to see if they needed to be tested. If they did need to be tested, they had a scheduled time to come into our testing center, and they were in and out in 10 minutes. So it was safer for those patients, and we thought that was keeping the community safe also. So we tested over almost 250,000 people at Lehigh Valley. We cared for thousands of COVID patients, and we vaccinated over 300,000. Today we're doing a mass vaccination up the Pocono Raceway. So a lot of people, finances were a concern last year. We didn't know, we closed all of our outpatient services. We stopped doing outpatient surgery, and we were very concerned what the financial impact was going to be on our network. So this is a slide of the last rolling 12 months, and it's comparing Lehigh Valley to networks from Pittsburgh to Philadelphia. And the top slide, if you look at it, it's if you include the CARES money that the government provided us, Lehigh Valley was the top performing hospital with a 4.6 operating margin, which is incredible how that we were able to do that in the last year. And if we would exclude the CARES money, the government money, and just looked at what we did from a revenue and expense standpoint, we still were able to have a positive bottom line. So that helped us continue our growth. We are building the hospital in Carbon. We're building one in Dixon City and Hecktown Oaks we're building. So there's a lot of growth going on in the network, but this positive financial performance is helping us fuel our growth. In addition, we were able to take good care of our employees. We said that they were very valuable and very important to us. During the last year, we gave our employees bonuses for taking care of those patients. We gave them merit increases for their great performance. And also we were able to fund our employee pension contribution in the last year. So that was a $100 million expense. So we said our employees were important to us, and we backed that up, and we really took care of our employees. So next slide, please. So how did our employees respond? We do survey our employees also, and we were named the Fortune Best Workplaces. So we received a lot of national recognition from our employees, and they do value Lehigh Valley as a great place to work. Next slide, please. So our Carbon Hospital is under construction. It was a little difficult designing a hospital and getting all the approvals during the COVID period, but the local township worked very well with us. The state agencies that we had to deal with were very cooperative, so it was a little longer than we anticipated, but at the same time, we've made very good progress. We got our last beam up a few weeks ago. Our hospital is made with American steel, and we're very excited about our new hospital, our new location right by Walmart. There's a Chick-fil-A going to be opening right in front of Walmart, so we know that they only pick great locations, so we're confident that our location is going to be great. Next slide, please. So here's a rendering of our new hospital. You can see I cut off on the far right is the emergency department. So that will be on the far corner. So patients coming from the Lehigh area will be able to drive right up and go right to the emergency department. The hospital will have 18 inpatient beds on the second floor. They'll all be private rooms with a view of the beautiful Mahoning Valley. And we have ability to expand another 18 beds on that second floor. We will have 2 operating rooms, 2 procedure rooms, and our emergency department will have 12 bays and 4 observation rooms in the ED. And everything in the hospital is built to expand either vertically or along each side. Next slide, please. So some of our services that we'll be offering will have complete telemedicine services. So every room will have telemedicine. We'll be able to contact a specialist at Lehigh Valley Cedar Crest for any service. So our patients will have access to every specialist down at Cedar Crest if needed. We will have cardiology services offered by our Heart Institute. Right now, we have 2 cardiologists in the market, and we'll be adding another one in the very near future. One of our cardiologists is Dr. Jeff Snyder. He's practicing a half a block from where he grew up on 9th Street, and his dad was the local primary care doc for 40 years in Lehigh. So we're very fortunate to have him. The Cancer Institute, we will be reopening our cancer services. We are affiliated with the Memorial Sloan Kettering network of cancer providers, and which is nice. We get some access to some great trials because of that national accreditation. Institute of Surgical Excellence will be part of our hospital. We will have multiple surgeons, orthopods, ENT surgeons. What's nice is we merged with Coordinated Health in the last year, and Coordinated has a great presence in Lehigh. We have 9 surgeons in the market, 5 orthopedic surgeons. Some of them are fellowship trained in sports medicine. We also have a minimally invasive fellowship trained general surgeon that will be part of us. So we're going to be bringing some outstanding physicians to the carbon market. And we will also have full service imaging services, MRI, CAT scan, ultrasound. So we will have the top of the line technology for radiology services. Next slide, please. This is the other end of the building. So there'll be a red light that's coming entrance right into this part of the building. This will be our health center. So the first floor will be outpatient services and hospital outpatient services. So the patients don't have to go into the hospital for these outpatient services. The second floor will be all occupied by our physicians. We have 45 exam rooms that will be able to be flexed. So we'll be bringing 30 new physicians into the market when we open next year. So we're very excited about that. Next slide, please. So in our health center, we'll have outpatient rehab. We have it in the market right now in 2 locations, and we'll be combining that. We'll be offering cardiac rehab to our cardiac patients. We'll have a full service pharmacy. Our infusion center will be reopening. And also we'll have our LVPG and coordinated health physicians in this building. Next slide, please. So the future of healthcare in Carbon County, the future is bright. The county residents will see increased access to inpatient and outpatient services. They won't have to leave the area and travel to Allentown for care at a Lehigh Valley Health Network hospital. Healthcare will have a huge economic impact on Carbon County. With all the growth, with all the new providers we're bringing, it's going to have a huge impact on our economy. We'll be adding 150 new jobs immediately, including physician, nurses, therapists, technicians, food service, environmental services. And there'll be a significant downstream economic impact when we open our hospital. So the future is bright, and LVN is proud to be your community partner. Next slide, please. And we've been fortunate. The Times News does a readers poll for the last 2 years. And for the past 2 years, Lehigh Valley was voted as the best hospital. So we do have a very good reputation in the community, and we're only going to see that reputation improve in the next coming years. And that's all I have. Thank you very much, everybody.
Thank you so much, Terry, for all that great information. Again, bringing us news about new Carbon County. Definitely looking forward to that. I'm going to hear from Joe Gargiani. Join us, rain or shine, for some great stuff happening. Walk with a Doc. That information is in the chat box if anyone is looking for that. If anyone does have any questions at this time, please go ahead and stick them in the chat box for us. I did want to tell you about some interesting stuff we have going on at the Chamber with our partners at the Pocono Mountain Visitors Bureau next Thursday, May 13th. If you're watching this at a later date, from 10 to 2 at Blue Mountain Resort, we will be hosting a career fair with the Pocono Regional Career Fair. The first time we're ever doing this. We have over 30 employers, including both of our health systems, on hand next Thursday to help you elevate your career in Carbon County. So if you're thinking about a career switch, looking for a new job or moving to the area, please join us live in person next Thursday, May 13th at Blue Mountain Resort for our Pocono Mountain Regional Career Fair. We haven't seen any questions come into the chat box just yet, but if you do have any, you can certainly contact us here at the Chamber. We'll make sure they get to our presenters. And we'll be happy to get the answers to you. For everyone that's tuning in today, we appreciate you taking the time to be with us and hope that you've enjoyed the presentations and the updates from our health networks. Thank you so much to our sponsors and presenters, and of course their teams for bringing us today's event. On behalf of everyone here at the CCEDC, we hope that you and your loved ones stay safe and stay healthy. We can't wait to get to that 70%, and we look forward to seeing you again very soon. The CCEDC State of the County series will be back in just a few weeks with an update from our education and employment sectors, so please be sure to visit our website and register today. Again, on behalf of everyone here at the CCEDC, thank you, gentlemen, for joining us in your presentations today, and enjoy the rest of your day.